Hello, my name is Tim. I'm the respiratory therapy manager here, and we're just going to take a short time here and shoot a video on how to set up the V60 Bipap machine, the non-invasive ventilator. So if nurses are helping us out and they want to bring the V60 in here, it's kept back in the room across from 117, the clean utility room there. It'll look just like this. It will be plugged in, so you have to unplug it, bring it into the room. It has to remain plugged in because it has an internal battery, okay? So you bring it into the room, just take the bag off, and what you'll see is this little circuit right here with no mask on it, okay? Just ones like that. Monitor, humidifier, and then a bunch of wires. So what I'm going to do is I'm just going to plug it in. So power plug here. Has to go into a red plug. And then we'll plug in the oxygen. We'll have to. Normally it has a flow meter attached to the end of the. Normally it has a flow meter attached here, but this one for some reason doesn't have it. Of course it doesn't because we're videotaping. So if it doesn't have a flow meter on here, it attaches to this portion, the PSI, the 50 PSI. It doesn't go where the Christmas tree goes, it just goes right here. Like I said, you shouldn't really have to worry about this because generally speaking, when you unwind it, it should look just like this. In which case you're just going to plug it into the oxygen outlet. Okay. Alright, so then it's plugged in. We have our light display saying that it's plugged in and ready to go. So I'm just going to hit the power button down here. Okay. It'll make a lot of noise. There's all the noise. So I'm just going to come down here. There's these little white tabs. I'm not sure how well they show up. It says standby. Going to hit standby, and in a matter of seconds it should go into standby. Okay, so that makes the noise all stop. So now we have to set the machine up, and we have to get the circuit ready to interface with the patient. So before I do that, I want to talk about the humidification. So if you're doing this because the respiratory therapist is tied up in a C-section or somewhere else, we don't really care about the humidification at this point. The dry air going into someone's lungs, past their nasal passages for 30 minutes to an hour is a small price to pay, and there's a lot that goes into humidification. Sometimes we use it, sometimes we don't. So we're just not even going to really worry about the humidification portion of this setup, okay? Because we just want to get it on the patient if we're tied up somewhere else, okay? All right, so here we have, like I said, we have the circuit. So let me just go over the machine briefly. This is where all the air comes out, right? So this is the outlet. Every V60 will be set up like this because whenever we get them cleaning it up after a patient, we pre-set it up for the next patient. So you never have to worry about finding blue circuitry or plugging in all these extra little lines. They'll already be ready to go, okay? So, but I just wanted to let you know, so the air comes out of the machine right here, goes down into the humidifier, and then if we had water in there, it would pick up humidity, and then of course the air will come through here. This is our pressure line, just to give you a heads up. If the patient becomes disconnected, this is how we know it becomes disconnected, because this is the lifeline to the machine, lets the machine know that it's a closed system and there's not a large leak. Okay, so that's right there, and this end connects right here. Okay, so that just kind of gives you a survey of the circuit. So now we're going to choose what mask to use. The way we do that is there's a little mask guide right here connected to this ring. So the ring just comes apart. And then, if you look on here, you will see this guide. It says small, medium, large, and extra large. So this right here will go between the eyeballs, Okay. Like so. And then you can tell where it comes between the lip and the chin, that's the size that you want. So for me, I'm either a small or a medium, okay? I would err on the size larger. So if it's small or medium, I would go with the medium, okay? Because if it's small, especially the small headgear, there's more play on the larger headgears. The small headgear doesn't have a lot of extra Velcro. So if they have a big melon head like me, you may not have enough strap to come all the way around the back, okay? So that's why I say, that's one reason why I say err on the size larger. I believe the medium, large, and extra large all have the same size strap. The small one just has the smaller strap. So the other reason why you want to err on the size of the larger is because if it's smaller, it's just going to have more of a risk of getting breakdown on the bridge of the nose, which is not where we want the mask. We want the mask right to set right between the eyeballs at the very, very top of the nose, okay? If it slides down on the bridge, that's when you get the breakdown, okay? Hopefully that makes sense. And we want the bottom part to rest right below the lip. If it's on the lip, then, you know, they're going to open their mouth and it's going to wind up being inside their mouth. So that's why I always say err on the side of the extra, you know, the extra larger size. Okay, hopefully that makes sense. So I would put that back where it belongs, and all the V60s should have this secured to the rail. Okay, all right. So now we'll go in the back of the ventilator, back of the BiPAP, and then we would just select the size. We should have all the sizes. We have 3 back here in this little tray, and then we have a bag that should have the 4th size, small, medium, large, extra large. I used to always put the extra large one in the bag, but I don't know what the other therapists do, so you just have to look and see. So I will pretend, I'm going to open this, I don't really want to open it, but it's super easy. It's got a little perforation right top. Just pull the well, actually I will open it because I want to go over how to secure it. It's worth the cost. So this is a medium mask. Just going to pop it out. So here's the mask. Normally it doesn't come apart like that, but it's okay because it just clicks together. It's pretty easy. Okay. Take the strap out. Then of course the strap is going to go over the back of the head. I think everybody's done this at least once or twice in their career. Just goes over the back of the head. And then this nose part, like I said, is going to go right between the eyeballs. Okay? Kind of like that. And what I always like to do is before I put the strap, unless it's an emergency, I always like just to sort of take it and put it on their face just to get them used to it first. And then let them kind of hold it. And then I'll show them, again, if time allows. If this is a true emergency, this is probably irrelevant, but I just want to go over. I'll always try to tell them, if they're with it, how these clips click on, okay? Because they have to be able to take it off, right? If they were to get nauseated or whatnot, okay? So the clips are just super easy to get on, super easy to get off. So usually, even if it's an emergency, I'll still just sort of hold this on their face. And then, it just sort of plugs in like so, okay? This is the exhalation port right here. And I don't like to have that blowing up in my face. So I always just turn it so it's kind of blowing on their neck, because I don't want them to exhale on us, okay? Especially if there's a lot of humidity can come out of there and you get sprayed, and I don't want us to get sprayed. So I always aim that toward the patient's neck. So there we go. I'll hold it on their face. And that's how that part works, okay? Now obviously we want to have some settings before we do all that. So that's what we'll discuss next. Can you see the screen okay?
Mm-hmm.
Okay.
Zoom in.
Okay. So it's a touch screen, as many of you are aware. So here we are in standby mode with all the various alarms that alarmed when I first turned it on. And so at the very bottom, we have these white tabs. It has your settings, your alarms, your mode settings, your alarm settings, your selection of the mode, whether it's BiPAP or CPAP or AVAPs or whatever, and then the menu, and then putting it in standby. So we'll just review all these right now. So if we go into the CPAP settings, which is where we are right now, you'll see these little blue tabs that are just specific for CPAP, okay? If I go into the modes, and then I change it from CPAP, which says batch CPAP, and I want to put it on ST. ST is BiPAP, for spontaneous timed breath. So spontaneous, if they're breathing spontaneously, which if they're on BiPAP, they need to be breathing spontaneously. That's what the S stands for, and then T is the timed, which means we can provide a backup rate. Okay, so that's just what ST means, spontaneous time. So if I hit ST, now I get all these different options. So again, remember, ST is BiPAP. That's the inspiratory PAP and the exhalation PAP. Okay, expiratory PAP. So here, the question is, well, Tim, what settings should I put on a patient if I'm not a respiratory therapist or a doctor? Well, the first thing is, hopefully you have spoken to the doctor, and the doctor is there, like Dr. Swanson's or Dr. Gasek or whatever, and they can kind of guide you, and they should guide you on what settings they want. But let's say the worst case scenario, there's no one around, and all the therapists are in a mass casualty event somewhere with all the doctors, and this patient's going south, and you want to put them on BiPAP. Honestly, 10/5, 10 IPAP, 5 EPAP is a great starting place, okay? And that's usually if I have a patient and I don't really know what's going on with them yet, I'm in the ER, I've just heard tell about this patient that's on their way, I'll just have this set up on 10/5. Because I know if that patient comes in, I can put them on 10/5 pretty safely. Like 99.9% of all patients can safely go on 10/5. And it's not that big of a deal, okay? Adult patients. So here we have 10/5, I'll just leave it there. But the next little soft key button is the rate. So that's the backup rate. So okay, so the question is, well, Tim, what backup rate should I put them on? Honestly, if I typically put them on anywhere between 12 and 16. So let's just say 14 then, okay? 14 is a good number as a backup rate. So you just press it, and you get the little number here with a left and a right, and I'm just going to go down by hitting that twice. Now it should say 14, and now I can accept or cancel. I'm going to go ahead and accept this new rate. Now you'll also notice that this is in kind of a brown color versus that blue color earlier when it was CPAP. Well, the reason why it's in this brown color is because I haven't activated the BiPAP mode yet. Because when I first turned it on, it was activated in CPAP mode. That's why all those keys were in blue. They're in brown here because I haven't activated them yet. So now I've got 10/5, I've got my respiratory rate of 14. Now I have to come up with an oxygen amount. And, you know, again, the doctor can tell you, but I think everybody in nursing should know what FiO2 to put a patient on if a respiratory therapist isn't there to help you, right? So if you know they're hypoxic, you want to increase the FiO2. We were taught in respiratory therapy school, 60% is a good starting place if you don't know anything about the patient. Now obviously if they're your patient in tele or ICU, you know they're on a non-rebreather or they have high oxygen requirements, then obviously you could put them on 100% as a good starting measure, and then you can wean them down based on their SpO2. All right? So again, let me just go back in there. So you just hit the O2 button, and then we got the left and right. We're going to go up to 60%. You just press and hold until you get 60%, and then you can accept. Okay? I do want to go back to IPAP and EPAP here just shortly. If I go back to IPAP, let's say the doctor says, well, you know, instead of 10/5, I want it to be 12/5. So you just hit it, and then the same kind of thing. You just go up to 12. All right, so that's kind of how you change the values, and then you would accept. And then if I want to go back to 10, I just hit it down to 10 and accept again. Okay? This next thing is called the I time. So that is the inspiratory time. That is, how long do you want that inspiratory cycle to last? How slow or fast do you want that breath to be delivered? If they're very tachypnic, you probably want the breath to be delivered faster. If they're just lethargic, or somnolent, then you probably want that breath to be delivered a little slower. There's a lot of variability in determining what your I time is going to be. And there's really too much to go into to describe why you would select one I time over another. So I'm just going to give you a ballpark number, okay? A ballpark number would be 0.80. So I'm just going to change that to 0.80. Okay? So we're at 10 over 5, a rate of 14, 60%, and an I time of 0.80. The next button is rise time. Really, whatever it's set, just leave it as is. Don't really mess with the rise time. It's not a mission critical type of setting, if that makes sense. Then the last one is this little, it looks like a ramp, a bicycle ramp. If you're going to jump over a soda can or something, bicycle, it says off. Again, it's not mission critical. Just whatever it is at, just leave it leave it how it is, okay? So just to review, we have IPAP, EPAP, 10 over 5. That's a great starting place for most of the patients. Hopefully you'll have a doctor who can give you some guidance, because maybe 10 over 5 is a good starting place, but maybe the patient needs more aggressive values. Well, then the doctor can lead you and tell you what the setting should be for those more aggressive values. But again, we're just talking baseline. Just get them on there until the therapist or the doctor can come in here and help you. So 10 over 5, a rate of 14, 60%, I time of 0.8, and the rise and the ramp, you would just kind of leave as however it is. And then you would just hit this button that says activate ST mode. You activate it, and now you'll see it's all in blue, and we're back over here on the far left tab, and it says ST settings, Bipap settings, okay? So now we're ready to put this on the patient. We have our generic settings, or the doctor has given us very specific settings to put in. So those are all set to go. Now we have the mask on, we've sized the mask. Now we're going to put this on the patient in the way I like to do it. Again, even if it's an emergency, I still like to just hold it on their face and see how they do with it, okay? And it's also another way to make sure your size is correct, because let's say you do all that, and then you think, oh, I want to take their teeth out. Well, that's going to change the size of the mask potentially. So, so here we are with the mask. Just going to, again, have this right here between the eyeballs, okay? And I'm going to put this on without activating the non-invasive ventilator. Okay, I'm just going to breathe spontaneously on here, and we'll see what happens. So I'll put it on. And you'll notice as I started to breathe, the machine just kicked on automatically, okay? Let me silence that alarm. Silence alarm is up here in the upper left-hand corner. So when I put it on, again, I would say 90% of the time, when the patient starts breathing spontaneously, the machine will just auto-cycle and turn on like magic. The 10% of the time that doesn't happen is when the patient is so frail or has an inadequate respiratory drive or is too weak and can't trigger, the machine can't sense that the patient is triggering the machine. So if they're weak and frail and very somnolent and don't have a very good respiratory drive, and you put this on their face, and after about 3 or 4 or 5 seconds, this hasn't turned on automatically, then I'll show you what you do. I'm going to put it back in standby by hitting that standby button. Now we're in standby again. So if I put it on the face and nothing happens, there's a button here that says Restart ST Mode. And it's a red button. So I'll put it on my face, but I'm not going to breathe. And that's to simulate what will happen. And then you'll just hit that button right there, okay? Okay. So there, the machine, I had to manually start the machine. It started to deliver our breath, and then once it started to deliver the breath, you could see the waveforms changed, and you could see volumes showing up, and I was able to receive a breath, okay? So then once I've had this on the patient's face for a while holding it, and I kind of figured out that they're doing okay with it, then I'll usually ask someone to help me, because you always need 3 hands when you put these masks on. Then I'll put the mask on, okay? So we'll go over, I'm going to put this back in standby. So now we're back in standby. And so I just want to go over, I mean, I think everybody knows how to do this, but I'll go over anyway. So when I put the mask on, what I'm looking to do is I'm looking to have the top of the mask right between the eyeballs, as I said. The bottom of the mask should fit right here in this little cleft area. And then I don't really want this to be super tight on the face because we don't want to have any skin breakdown. And as you guys know, it doesn't take very long to get skin breakdown. So you just adjust the Velcro to make sure that it's not too tight. What I like to do is I just like to be able to fit 2 fingers between the strap and the cheek. And if I can do that, then it's probably not too tight. Now there is a challenge when male patients have facial hair. The facial hair creates gaps between the mask and the face so that air can escape. And so you can have these big leaks, okay? And I'm going to go over some of that here in just a moment. But so like oftentimes what I'll do is I'll get the shaver out and I'll just shave, you know, a little bit here so that I can make sure that the outline of the mask, you know, can fit without having a lot of hair. Can you do it when they have a lot of hair because you're kind of in an emergency? Absolutely. Just put it on there. Worry about the hair later. And if it means you have to have it a little bit tighter so that you don't have this humongous leak for like 20 minutes or 30 minutes because you just have to get this going, then you know that's okay. 20-30 minutes with it a little tighter. As long as this isn't, you know, compressing on the bridge of the nose, you're probably going to be okay for a while, okay? The challenge is when this gets on right here across the bridge of the nose, 20 or 30 minutes of that can be pretty tough. So the second thing I like to do is I like to have this sitting as low on the face as possible. So because this has a tendency to kind of rise up. So if you have this, you know, on the person's face, and the straps are as low as possible, then A, it won't cut into the ear, and B, it won't start to rise up on the face as much. What else do I want to talk about as far as the mask goes? Oftentimes you put this on the mask. Well, first of all, I just want to show this thing will pop out like that. It's got a little ball right there and a little, I guess, socket right there. So that just clips on, okay? But usually when this is on, the biggest place for a leak is typically going to be right here under the lip. So there's a little white button right here. If you push the white button, it'll extend off the forehead, and it kind of rocks and will push a little bit more on the chin. And if the majority of the leak is always around the bottom part of the lip, then sometimes pushing this button and extending it from the forehead will rock it back into the chin. Hopefully that makes sense. I don't know if you can see it very well or not. Okay, so now I'm going to go ahead and turn our attention back to the screen and I want to mention the alarm settings. So if we go down here to these white tabs, so we've talked about the modes button. That allows us to select CPAP or BiPAP. AVAPs, don't worry about AVAPs. That's BiPAP ST can do everything we need it to do for that moment in time. Okay? So you go over here to the far left. So let's say the patient's on the 10/5 and the doctor shows up and says, oh, okay, well I know respiratory is not here, but I would like to change that from 10/5 to 12/5. So you would just select this key over here on the bottom left where it says settings, and then you just select IPAP. You'll see a similar screen with the two arrows. Just go up to 12 and then accept. But you notice it's in blue, it's not in brown like it was earlier, because we're already in that mode. So I'll click accept, and now we'll see 12/5, it's all in blue, so it's already been selected. Okay? So the next button next to it is the alarm settings. Typically the respiratory therapist will have set the alarm settings for the previous patient, and I would say that 95% of the time those alarms should be adequate for this next patient, okay? And so there really isn't too much you should have to do with the alarm settings, and honestly, if there's a low respiratory rate alarm or a high tide, if there's some kind of alarm going off, you should be able to troubleshoot it pretty easily. But let's say the patient's just breathing super fast. They're super tachypnic, they're breathing 50 times a minute, let's say. Well, you notice here in our alarm settings we have a high rate of 45, they're breathing 50, pardon me, and you have two choices. Your first choice is to realize that they're breathing 50 because you just put this intervention on their face. Hopefully, over a course of 3 or 4 or 5 minutes, they should slow down. But if you're just one of those inpatient people and you don't want that alarm to go off and you don't have the alarm silence, you get a high rate, same double arrow left or right, and then you can just increase it to 51. And now your alarm won't go off. But as I said earlier, you really shouldn't have to adjust any of the alarms because we have set it for the previous patients. And in fact, when I put a patient on BiPAP, very seldom do I ever have to adjust the alarms, because BiPAP is a pressure-driven mode. So it doesn't. So we're looking at pressures, and we always manage the same pressures from patient to patient typically, and the volumes don't typically change very much. So there really isn't too much you'll ever have to adjust on the alarm settings. I hope that's pretty clear. So we have the mode settings that we're on, the alarm settings. You can select the mode that you want, and then you have the menu key, which you really should never ever have to do anything with. You would never have to adjust the brightness of the screen, the loudness of the alarm, the type of port that we use, things like, it's just nothing you'd ever have to do. And then we've already talked about the standby button, okay? All right, so let me switch back over to activate the mode. So we're going to activate the mode. You'll see all these alarm settings are here. It's alarming because I don't have it on a patient. I'm at the alarm silence over here in the upper left-hand corner. So it's going to silence that alarm for 2 minutes. And then over here we have the alarm reset. Alarm reset will clear out all these alarms as well as reset the alarm silence. So I'm going to do that right now and we'll see what happens. All those alarms went away. We got a full screen. But again, the next breath was delivered. It's obviously not a closed system because it's not on a patient. And so we get the patient disconnect alarm. Hopefully that makes sense, right? And honestly, a bunch of other alarms should follow in suit, okay? And we should see a whole list of red things here. And then if I reset it, It's nice and quiet until it starts to alarm again. Alright? Hit the alarm silence. So hopefully that kind of talks about the alarm reset and the alarm silence. And again, all your different alarms will start to list here on the right hand side. And you look up here, you'll see it says high priority alarm. Okay? You'll also notice right here are all these measurements. It's measuring how many breaths per minute. I have it set on 14, and sure enough, the machine is delivering 14 breaths a minute. If I had this on me and I was breathing spontaneously, that would be a different number probably. Here we have the tidal volume. How much volume is being delivered to the patient that they're exhaling. So you'll also notice this is VE, that's minute volume. How much minute volume is being delivered in a minute. Peak inspiratory pressure. What's the peak inspiratory pressure? That's your high pressure. It's like on a ventilator. Now over here we have patient leak, and that's what I want to get to. So this is called the V60. Down here you see V60. Well, why did they call it V60? They call it the V60 because you can have a leak of 60 liters per minute or less. And if you have a leak of 60 liters per minute or less, then you can ventilate the patient just fine. Notice our leak is 100 liters per minute. Well, obviously I don't have it connected to a patient, so everything we have is a leak. But I want to draw your attention to the tidal volume. See here it says 1200, 400, 1100, 1700, 600. It's going to be all over the map, okay? There's 1,000, obviously because it's not a closed system. So if you have greater than 60 liters a minute of a leak, and this is on a patient. Sorry, my 2 minutes ran out, so I had to hit the alarm silence again. So if I had this on a patient, I had a leak of 60 liters or greater, I cannot trust that tidal volume number, okay? So if I have a beard and it's leaking and it's 100 liters a minute of leak, and I have a tidal volume that says 900 or 800, one might think, oh, well, I have this huge leak, but it's okay because I still get these big tidal volumes. No. If you have a leak of greater than 60, you cannot believe the tidal volume number. It's probably much, much less than whatever you see there. Because see, I don't even have it connected, and it says 1200. So that should tell you all you need to know. Now I'm going to put this on, and I won't be able to talk where you can hear me, but I just want Janine to kind of look at the screen with the camera, and then I'll be pointing to some things that I want to draw your attention to, and then I'll talk about it when I take the mask off. Okay? So first of all, I want to draw your attention to the alarm situation once I put it on my face, and I have 45 seconds left on my alarm silence. So I'm just going to put it on my face, and I just want you to see what happens to the alarms. Okay, wow, what a rush. If you've never had a Bipap on your face, you should try it sometime and see what it's like. It's crazy. Okay, so the first thing I wanted to show is that I had the mask on and there were still 20 or 30 seconds left in my alarm. And so when the alarm time expired and the 2 minutes had been silenced, I was breathing so it didn't automatically alarm again, right? Because there was no longer an alarm condition being met. So once the patient is on here and an alarm is sounding, if it takes care of itself, the alarm will stop. You'll still see the message over here, okay? But the annoying will stop, okay? So I was breathing fine, everything was going great, and it expired and everything was fine. No more alarm condition. So then I hit the alarm reset and the screen went to the normal screen, where it just showed all these waveforms, and I'm not going to go into any detail. I also wanted to point out that my tidal volume was adequate and my leak was perfect, right? It was like 17 or 16 or somewhere in that ballpark, so it's below 60. So I can believe the tidal volume that I was receiving. Now because I'm quote unquote healthy, that 12/5 gave me these really large tidal volumes. But again, for 20 minutes or 30 minutes, that's acceptable, okay? And then my leak was fine, my respiratory rate was 21, so I was breathing spontaneously in addition to the mandatory breaths that or the backup rate, I guess is a better way to say it, that the non-invasive ventilator was giving me. Okay, so I think I'll just recap real quick. That when you, oh, there's my alarm. When you bring it in the room, you're going to plug it into the power outlet, you're going to plug in the oxygen, you're going to turn it on, you're going to put it in standby so the alarms don't annoy you. You're going to fit the patient with the proper mask using the little card that we have on the ring. Err on the size of going, the size larger if there's any question. Put the mask on, then you're going to come over here, you're going to put them in Bipap, you're going to hit mode if it's not already in ST, mode, and if you don't know if it's an ST, just hit mode, and if you see that ST is in blue, then you know it's already in Bipap mode, okay? So we're in ST, come over here, oh, okay. Because I hit ST, it wanted me to put the ST settings in. So ST is already there, so I'm going to go to my ST settings on the far left-hand tab. I'm going to make it 10/5, unless the doctor's there, which hopefully they will be, and they will give you the settings. Okay, I really want to stress that. Because for example, let's say it's a little frail COPDer. I see them and I think, oh, maybe 10/5 is too much. Maybe 8/3 is a better setting, right? So, I mean, 10/5 is good most of the time, but there are unique situations where, the doctor really has to give you the settings. So 10/5, my default rate of 14, 60% unless you know that they need more oxygen, but 60 is just a good starting point. The I time of 0.8, and you should be ready to roll, okay? That should be good unless, again, the doctor gives you settings. And if you want to change this, oh, my 2 minutes went up. If you want to change it again, you just hit whatever the key is, hit one arrow or the other arrow, and then click accept, and you should be golden. And then when you put the mask on, I always do it manually first before I put the strap on because I want them to get to know it. I actually want them to, sort of hold it themselves if they want to help you hold it on their face. This should be at the top between the eyeballs, not on the bridge of the nose. This should be right between the little cleft area, between your lip and your chin. Once you get it on there, then put the strap on, and then explain to the patient how to undo the strap if they were to feel nauseated. And then make sure they are not restrained, and make sure that they are breathing spontaneously, because you cannot put this on someone unless they are breathing spontaneously. If you have a patient that's not breathing spontaneously, or they're so somnolent that they're only breathing 2 or 3 or 4 or 5 times a minute, you just need to get them intubated, okay? And if there's any question, if you're like looking at the patient, Like, oh, well, I remember Tim on that video, he said if there's, if they're somnolent or, they have this super depressed respiratory drive that we should, I'm not really sure about this patient. I've heard they're coming from the ER and all this. You just need to call the doctor up and share your concerns, right? Because the doctor has the right to practice medicine. They can be the one to give us guidance and direction if we have any questions at all. And I would say as a general rule, when it comes to this particular factor, I've never had an issue with a physician being more than appreciative of me asking for help, asking for direction, and then, of course, them giving me the direction, okay? And the next thing I think I want to move on to is we'll take a break, and then we'll talk about breathing treatment.